Congratulations on the new addition to your family. We know this is an exciting time. We would like to take just a few moments to talk to you about infant distress. Infant distress means your baby is having difficulties. Knowing what to look for will help you know if your baby is in distress. Your baby may have breathing problems, such as retractions, grunting, and apnea. Retractions are unusual breathing movements. With each breath, your baby's chest muscles pull in the skin around the bones. Grunting is a noisy breathing sound. Your baby may grunt to keep air in the lungs. Grunting may sound like snoring or singing. Apnea is a condition in which your baby pauses breathing for 15 to 20 seconds. Then continues breathing. You may notice changes in your baby's skin. Two common findings are conditions known as cyanosis and jaundice. Cyanosis is a blue skin color. You can usually see it around your baby's lips, chest, and stomach. This blue color means that the oxygen level in the blood may be too low. Cyanosis may mean there is a problem with the baby's lungs or heart. Jaundice is an overall yellow skin color. It happens when a substance called bilirubin builds up in the blood. Most babies have some jaundice that appears more than 24 hours after birth. If left untreated, severe or long-lasting jaundice may cause brain damage. It's important to check your baby for these signs of distress. Immediately contact a member of your healthcare team if you notice any of these warning signs.